going to start with the short needle, which is this one, 7 centimeters long. I normally like to grab the tissue that I'm going to inject, I'm about to inject, and at the same time that I'm lifting and pinching, just get the needle in, sharp scratch, and in, okay? So before doing anything, I just make sure that I'm in the right layer. Do you feel anything? No. Okay. And for that, I'm going to just do some passes inside the fat tissue, okay? You alright?
Yes.
And also getting myself familiar with the length of the needle, okay? Because I have 8 mL per vial and I'm doing 2 injection points, one here and one opposite to this one, it makes sense that I will be injecting 4 mL per injection point, okay? So I'm going to start in my injection, okay, ready? So it's a fan-shaped technique and I'm injecting only when pulling my needle out. And here, the more passes I make, the better. You okay?
Yes.
Also, because this is a chunk of tissue, you need to increase the angle like this to make sure that you are also treating the depth of the fatty tissue. So I completed the 4. I'm done with this. Now I'm going to complete the right side coming from this part, okay? Ready? Sharp scratch coming up. Okay. Same thing. I'm going to first make sure that I'm the right layer. Sometimes you pull out the needle, that's absolutely fine. Back in. And then I will start my injection. The theory says that you have to inject less than 0.5 mL per pass. But as you can see, I'm not paying any attention to the amount I'm injecting because basically what I'm doing is going inside, very small amounts per pass, go back in, very small amount per pass, go back in, and then notice that this is a simultaneous thing. At the same time I'm pulling my needle out, I'm injecting very small amounts. See how I am increasing my angle. And I'm done. This is the long needle, 10 centimeters long. So, one thing that we all tend to do is, because we have such a long needle, we always think that we have to use the full length of the needle, which is far from reality. You shouldn't be using the full length at all times. So instead, before the injection is actually done, just on the outside, make sure that you measure the length of your needle. And in this particular case, I know that I will not be using the full length, but perhaps 3/4 of the length, okay? This needle is more flexible compared to the other. So another thing that you should always be mindful of is that sometimes you get in and the needle is actually bending up, okay? And then eventually you can piece the skin on the other side. So these are some features that are slightly different from this needle compared to the other one. I recommend almost all the time to get started with the short needle, but this is a really, really good tool to use, particularly in bigger abdomens, okay? Sharp scratch, so do the same, just going in and out without any injection. And it's very important that you feel zero resistance when doing this. Notice how I'm just barely holding the needle and the syringe, I'm not applying a lot of pressure because it needs to be felt like butter, literally. Okay. Then again, I lift up so I have better control of the situation, and then I will start injecting, remembering that I don't need to use the full length of the needle. Okay. So let's get my injection now. And here, sometimes you need to make sure that you're pulling almost the full needle out before changing direction, because otherwise, look what happens. I'm just bending the needle, I'm not effective in delivering Aqualix, okay? So it's really important to make sure that you're almost out, and only there is when you change the direction of your needle and not go back in. And similarly, I can increase the angle, as you can see here, and go deeper. You're still safe, but you are way more effective in delivering your Aqualix. So this one is done, and I go to complete the treatment on this side. On this side, again, sharp scratch. Notice how quickly I introduce the needle to minimize any possible discomfort for the patient. And then I just do some passes without any injection. I feel no resistance, which is great. And then I start injecting. With this long needle, it's challenging not to go across. This finger, it feels the tip of the needle. If I keep pushing, I guarantee you that the skin will be pierced on this side. So just pull back, make sure that you slightly increase the angle with a long needle, and you will be just fine. So I'm not injecting anything when I'm in. I'm pulling out when I do my injection. And done. This is the proper and the right technique to inject Aqualix, which is called intralipotherapy.